We are recording this webinar and we'll be posting it online later. So thank you all to have joined us this morning. We had over 300 people register for this webinar. We're really excited about the enthusiasm around this topic. Here at the Exchange, we have several eligibility experts from both the Healthcare Authority and the Exchange available to answer questions that you may have. Kathy, if you could advance it. Today we're going to be talking about three main topics that we've received feedback on from stakeholders that are central interest areas. The first is just a general refresher and reminder of the eligibility flow related to entering information in Health Plan Finder about citizenship status, about lawful presence, how that flow looks, and so we're going to do a quick review of the eligibility results in the online application flow. We'll then move on to document verification. This is the process that occurs when an individual who's eligible either for Washington Apple Health or for a qualified health plan needs to submit additional documents. So we'll walk through at some level of detail what that process looks like. And finally, we have a third section related specifically to a new federal regulation it's a tax credit rule for lawfully present individuals who are ineligible for Medicaid by reason of their immigration status. This is a particular subgroup of the immigrant community, and we've done some recent fixes in Health Plan Finder to improve the flow related to this group, and we'll walk through what those fixes are. We wanted to make sure everybody knew about it. We'll also be pushing information about that fix out to all of our consumer assistant network and our call center representatives. Finally, sort of generally housekeeping issues, we'll have a section, we'll have a time, we'll reserve 10 to 15 minutes at the end of each section to ask questions. Questions we're unable to address on the webinar, we'll also make sure to follow up with this group about. So again, please submit questions either as you have them, and we'll look through them and address as many as we can at the end of each section. We have a fairly packed agenda, so I'll try to stay honest in time, and we'll try to move through as expeditiously as we can. So moving to the first section. The first section is with regard to eligibility. Again, we wanted to remind people, we continue to hear sort of questions and concerns when we're out in the community around whether or not people without a Social Security number can use Health Plan Finder. They can. Whether undocumented parents can apply for their children. They can. Whether you have to have an SSN to get to sort of qualify for a qualified health plan or the tax credit. You don't. You can use an individual taxpayer identification number. And what we use this information for and who we share it with. And again, just wanted to reiterate that information entered into Health Plan Finder is not used or shared for enforcement purposes. The next slide again is a reminder, just more on SSNs, and sticking with the general theme that if you have an SSN, the general rule is that you have to enter it into Health Plan Finder. If you don't, you can still apply. People without SSNs or who are undocumented are eligible for certain federal and state funded programs, which we'll cover more later. And the final point is really important. This is something that we saw early on. I think there's a tendency to leave individuals without SSNs off the applications. It's really important that those members are included on the application. We need information about them to make a correct eligibility determination for them applying for coverage. So we always like to encourage people to include all members of their household on the application, even if they don't have an SSN. Finally, with regard to SSNs, it's a critical piece of information in terms of electronically verifying eligibility status with the federal hub. So we use SSNs to verify through federal databases. SSNs are also commonly used to verify citizenship. They're also, just as a side note, used to verify incarceration status for QHPs. So again, if someone doesn't enter an SSN or they put in an SSN and it can't be validated through the federal hub, typically there is a lot of, a good amount of follow-up that needs to be done in terms of submitting documentation in order to get the person verified.